Welcome to Weekly News Highlights. Prime Minister Boris Johnson effectively closed down the United Kingdom, ordering restaurants, theaters, cinemas, and gyms to shut their doors in a bid to slow down the accelerating spread of COVID-19. Meanwhile, Johnson's Finance Minister, Rishi Sunak, launched a gigantic stimulus package to stabilize Britain's virus-hit economy, including the government paying the wages of workers up and down the country. Sunak said Britain would take the unprecedented step of pumping money into companies in order to pay workers' wages and cushion an expected surge in unemployment, as much of the economy goes into a near shutdown due to the COVID-19 outbreak. He said there would be no financial limit to the size of the plan. Sunak also said businesses would be allowed to hold on to £30 billion of value-added tax, which they would normally pass on to tax authorities over the next 3 months in order to help their cash flow. Chilean lawmakers said they had reached an agreement to postpone until late October a much-anticipated referendum on a new constitution, as safety concerns around the COVID-19 outbreak take precedence over politics. The referendum, originally slated for April the 26th, will be rescheduled for October the 25th. The deal still requires formal approval by 2/3 vote of Congress. Meanwhile, Chilean President Sebastián Piñera announced a state of catastrophe to confront the growing outbreak in Chile. Giving the government extraordinary powers to restrict freedom of movement and assure food supply and basic services. He announced a $12 billion economic aid package. Chile's health ministry has confirmed 342 COVID-19 cases in the country, among the highest tallies in Latin America. However, no one in Chile has died from COVID-19. The South American nation has already closed schools, shut down its borders, and limited public gatherings as the number of COVID-19 cases soared. The World Health Organization Director General Tedros Adhanom Ghebreyesus said COVID-19 can sicken or kill young people, who must also avoid mingling and spreading it to older and more vulnerable people. Ghebreyesus told a virtual press conference that young people are not invincible, and that the virus could put them in hospitals for weeks or even kill them. Even if young people don't get sick, the choices they make about where they go could be the difference between life and death for someone else. The WHO's top emergency expert, Dr. Mike Ryan, said amid shortages of protective gear for health workers and diagnostic tests, air bridges will be needed to bring supplies to countries for vital health workers. Ryan also said that the WHO has distributed 1.5 million lab tests worldwide, and it may need potentially 80 times that number for the pandemic. US President Donald Trump said he greatly respects China and Chinese President Xi Jinping, but that it was unfortunate the COVID-19 virus began there and got out of control. US Secretary of State Mike Pompeo, referring to the quote, Chinese virus, unquote, a term President Trump has used repeatedly, greatly angering Beijing, told the same briefing of the US COVID-19 task force that Beijing's delay in sharing information about the virus had created risks to people worldwide. Pompeo said it was not a matter of appointing blame, but the Chinese government was the first to know about the risk the virus presented and was slow to share vital information. President Trump ratcheted up his rhetoric against China over the COVID-19 virus this week, saying Beijing should have acted sooner to warn the world, and dismissing criticism that his labeling it the Chinese virus was racist. A passenger ship docked at the Italian port of Genoa is set to become a hospital for people suffering from COVID-19, as Italy's death toll overtook that of China, where the virus first emerged. The ship, known as Splendid, is expected to look after patients from next week, as overwhelmed hospitals in Italy struggle to cope with the growing number of people testing positive for the virus. At Italy's busiest airport in Rome, police made checks on the very few passengers still traveling. All people leaving their homes in Italy must carry a self-certification document that states the reason why they are not indoors. Italy went into virtual lockdown before other countries in Europe, but with cases still rising, the government is considering even tougher measures that would further restrict the limited amount of outdoor movement currently permitted. The United Nations Relief and Works Agency, or the UNRWA, is in urgent need of $14 million to prepare and respond to the new COVID-19 pandemic during an initial period of 3 months. The UNRWA identified immediate priorities and financial requirements for health and other services in many countries, as well as regular budget needs that define the agency. More details with Yumna Sayed.
The United Nations Relief and Works Agency for Palestine Refugees, UNRWA, announced that it urgently needs $14 million to prepare and respond to the COVID-19 pandemic and for an initial period of 3 months. The urgent appeal by the agency outlines the immediate priorities and financial requirements for health and other pandemic services in the West Bank, including East Jerusalem, Gaza, Jordan, Lebanon, and Syria. This urgent appeal comes in addition to UNRWA's regular program budget needs.
We are, suffering a huge deficit in our budget. Right now in this year, we have pledges with $299 million. We received only about $170 million. But after that, I think if we don't get the proper funding to our operations, the 5 fields of operation, we will be forced to take, some restricted measures.
The overcrowded living conditions, physical and psychological anxiety, and the protracted years of conflict are making the community of Palestine refugees at risk of more than 5.6 million vulnerable to COVID-19 infection, says UNRWA's acting Commissioner General, adding that all countries and authorities hosting the agency's 5 fields of operation has announced a series of strong measures aimed at dealing with the spread of COVID-19 virus, which the agency will follow within its operations.
The health system in Gaza is shaky for the last decade. Gaza is facing lots of challenges, including the shortages of drugs and disposables, the lack of equipment, the human resources issue of the limited payment of salaries, plus generally the resources in Gaza are very limited.
Commissioner General called out to all donors, whether governments, institutions or individuals, to help UNRWA cope with what could become a catastrophe of unreasonable proportions in places like Gaza, which simply does not have the resources and means to cope with such situations.
U.S. Vice President Mike Pence said he and his wife will be tested for COVID-19 after a member of his staff tested positive. Pence said the White House doctor has indicated he has no reason to believe that he was exposed and no need to be tested. During the daily briefing at the White House, Assistant U.S. Secretary for Health Brett Grier said more than 195,000 people in the United States have been tested for COVID-19 and received their results. He added that the priority for testing includes healthcare workers, symptomatic individuals, and the elderly. The French army was setting up a field hospital in the city of Mulhouse in eastern France, with 30 intensive care units, as authorities sought to ease the strain on hospitals in the east of the country that are struggling to cope with the spiraling numbers of cases. Earlier, the French government put its 67 million people under lockdown and an unprecedented act during peacetime, after an almost 20% rise in deaths and reported cases in just 24 hours. Eastern France has been worst hit, as doctors are reporting 10 new critical cases a day, a shortage of equipment and masks, increasing fatigue, and growing number of hospital workers also falling ill. They have said that they may need to start deciding which patients to prioritize. The Ministry of Health has recently received a batch of early detection kits for COVID-19. The Ministry of Health and various sectors are keen to provide all means and efforts to limit the spread of the virus. Adil Fahed has more.
Yesterday, the devices for the rapid inspection of the coronavirus arrived. This is the first batch of the total million devices which will arrive in Kuwait later this month. The new inspection devices will be in service soon at all airports of Kuwait, and the medical staff will assist in speeding up the diagnosis and in completing other procedures.
We're expecting today, the Friday the 20th of March 2020, shipment from China that has the medical devices and equipments necessary for treating and for knowing the patients for coronavirus. Now this is the first shipment, and other shipments are following up in the weeks to come, inshallah.
The device can detect COVID-19 disease within 10 minutes as a maximum, as the blood sample will be taken from the exempt person and placed on the device, which will in turn declare the positive or negative of the sample.
So this was a marathon of a flight that took 4 days to set up. It was predominantly to bring the rapid testers from China. The crew and everybody, all the logistics worked beautifully for us to do this marathon flight. We brought in about 400,000 testers. They're being offloaded right behind me right now. I thank the crew especially because it was a very, very hard trip. Engineering did a beautiful job. You can see it was a big team that went to make sure that we were self-sufficient and can operate the flight on our own. And I honestly thank Kuwait Airways, the Ministry of Health, the Ministry of Interior, and the Civil Aviation for the support that we received to make this flight successful.
The ministry is fully prepared to receive thousands of citizens from several countries.
After an emergency meeting last Sunday, the International Olympic Committee, or the IOC, said it would step up its scenario planning for the Tokyo 2020 Games, including their postponement. The IOC will hold detailed discussions which will include possibly changing the July 24th start date, but emphasized that a cancellation of the Games would not solve any of the problems or help anyone. The IOC is facing mounting opposition to the current schedule for the Games as athletes, teams, and federations call for a delay due to the COVID-19 pandemic. The Russian army began flying medical help to Italy to help it battle the new COVID-19 cases after receiving an order from President Vladimir Putin, a goodwill gesture that Moscow labeled "From Russia with Love." Giant Il-76 military planes began taking off from an airbase in the Moscow region after President Putin spoke to Italian Prime Minister Giuseppe Conte, and agreements were later reached between respective defense ministers. The Kremlin said Russia was sending truck-based units capable of disinfecting vehicles, buildings, and public spaces, as well as medical specialists and equipment, including testing devices, to the worst-hit Italian regions. The team included some of Russia's leading medical military specialists who had first-hand experience of fighting outbreaks of African swine fever and of developing vaccines against Ebola. The Russian Defense Ministry said its help being sent on 9 military transport planes would consist of 8 medical brigades, plus around 100 other personnel, including the epidemiological and virus experts. Germany tightened curbs on social interaction, including a ban on public meetings of more than 2 people, to slow the spread of COVID-19. At a press briefing, Chancellor Angela Merkel said the expanded measures would be in place for at least the next 2 weeks. She said people will not be allowed to form groups of more than 2 in public unless they live together in the same household or the gathering is work-related. As part of a bundle of stricter rules, restaurants can only offer takeaway services, and hairdressers and beauty salons must close. Shortly after the briefing, Merkel's spokesperson said she would be going into quarantine after coming into contact with a doctor who has tested positive for COVID-19. He said she should continue to work from home. Cuban doctors and nurses arrived in Italy last Sunday to help stop the spread of COVID-19 in the region of Lombardy. The group from Cuba consists of 36 doctors, 15 nurses, and a logistic expert. Italy is one of the countries hardest hit by the COVID-19 pandemic, with 5,476 deaths at the time of this recording. Cuba has 8.2 doctors for every 1,000 people, one of the highest rates in the world according to the World Bank. Cuban medical brigades have already helped fight the spread of COVID-19 in countries including Jamaica, Venezuela, Nicaragua, Suriname, and Grenada. His Highness the Emir, Sheikh Sabah Al-Ahmed Al-Jaber Sabah, lauded extensive measures carried by Kuwaiti authorities and people of the country to counter the spread of COVID-19. In a televised address, His Highness the Emir affirmed that he is following up with great pleasure on the sequence of steps as well as bold and decisive measures taken by the government bodies to counter the pandemic. More in the following with Umar Al-Husaynan.
His Highness the Emir Sheikh Sabah Al-Ahmed Al-Jaber Sabah lauded extensive measures carried by Kuwaiti authorities and people of the country to counter the spread of the coronavirus, stressing that it was time to expand solidarity to overcome this global health crisis. In a televised address, His Highness the Emir reflected on the situation created by the coronavirus worldwide, saying that Kuwait had been affected by the global pandemic that killed tens of thousands and infected over 200,000. His Highness the Emir indicated that he directed the government of His Highness Sheikh Sabah Khalid Al-Hamad Al-Mubarak Al-Sabah, the Prime Minister, to take measures to ensure the safety of the people of Kuwait, both nationals and residents. His Highness the Emir affirmed that he is following up with great pleasure on the sequence of steps as well as bold and decisive measures taken by the government bodies to counter the pandemic, commending efforts of the government's officials and staff in fighting the coronavirus outbreak. Moreover, His Highness the Emir said he directed state bodies to contact the Kuwaiti citizens and students abroad to ensure their safety and return to home in accordance with health guidelines. His Highness the Emir praised the actions of all those who put their lives on the line and in service of the country during these hard times, saying that their efforts will always be remembered. His Highness the Emir also hailed the National Assembly Speaker Marzouk Ali Al-Ghanem and MPs for their cooperation with the Cabinet during the coronavirus crisis, saying that their collaboration will contribute to fight against the disease. Additionally, His Highness the Emir also thanked all members of society and private sector for their positive contribution to battling the spread of the coronavirus. Commenting on the situation globally, His Highness the Emir expressed sorrow over the impact of the coronavirus on the world, saying that it was necessary on the national level to continue the stride to safeguard Kuwait during such crisis. His Highness the Emir confirmed that food supplies are plentiful in the country, adding that it is important to protect such resources from overconsumption and irresponsible usage. His Highness the Emir stressed that at the current situation, it is important to focus on controlling the pandemic and saving lives as a priority, and also affirmed that it is important to look forward beyond the current situation and address social, economic, and educational consequences of the virus outbreak in the future. His Highness the Emir said he was aware of the severe impact of the coronavirus spread on the morale of Kuwaitis and residents alike. However, he affirmed that Kuwait would overcome this crisis through unity, solidarity, and sacrifice. Finally, His Highness the Emir urged for patience and confidence during these troubling times to overcome this grave situation.
The Ministry of Health said tests used in rapid point-of-care COVID-19 detection arrived in Kuwait, making it the first country in the region to obtain such a method. Assistant Secretary at the Ministry of Health, Dr. Abdullah Al-Badr, affirmed the tests using molecular methods will speed up the process of detecting COVID-19 within a time frame of 45 minutes. Al-Badr added that the tests, approved by the U.S. Food and Drug Administration, arrived in Kuwait in coordination with local and international drug companies. The Ministry of Interior continued its security campaign, calling on citizens and residents to abide by the newly imposed curfew aimed at containing the spread of the COVID-19 outbreak in the country. The ministry stressed that applying the government instructions is a must and warned against violating the rules and measures set by state bodies. Hadil Fahed has the details.
Within the precautionary measures taken by state, the Ministry of Interior plays a large and important role in combating the coronavirus, in implementation of the cooperation protocol between the state agencies and supporting the Ministry of Health to preserve the public health of Kuwaiti society.
There is great cooperation shown between state institutions and bodies, all represented by the Civil Defense Committee, such as the Ministry of Interior, the National Guard, and the Army. Everyone is under the authority of the Ministry of Health in this crisis. All services are extended to the Ministry of Health to provide all the needs, from securing quarantines and transporting the injured, and all that the Ministry of Health requests, or the sectors represented in implementing the Cabinet's decision. The Ministry of Interior is ready to support all services. The main goal is to protect citizens and residents of Kuwait.
Many tasks were assigned to the Ministry of Interior, all of which fall into one framework, which is to protect the citizens and the residents of Kuwait.
The Palestinian Ministry of Health said that the Israeli occupation forces shot dead a Palestinian youth west of the West Bank city of Ramallah. Eyewitnesses in the village said the Israeli occupation forces opened fire at a Palestinian vehicle which had 2 persons. One was hit and the other arrested. His Highness the Emir, Sheikh Sabah Al-Ahmed Al-Jaber Sabah, chaired an extraordinary meeting of the Council of Ministers that was held at Dar Salwa in the presence of His Highness the Crown Prince, Sheikh Nawaf Al-Ahmed Al-Jaber Sabah, the National Assembly Speaker, Marzouk Ali Al-Ghanim, and the Minister of Emiri Diwan Affairs, Sheikh Ali Jarrah Al-Sabah. In a speech at the meeting, His Highness the Emir expressed his sincere thanks and appreciation to the Prime Minister and all ministers for their kind suggestions out of concerns to leave the country due to the COVID-19 outbreak. His Highness the Emir added that Kuwait is the first country that preceded others in the face of this dangerous disease. Thanking Marzouk Al-Ghanim, the Speaker of the National Assembly, and His Highness the Prime Minister, Sheikh Sabah Al-Khalid Al-Hamad Al-Sabah, for their cooperation and building a bridge between the Cabinet and the National Assembly so that all members of Parliament become aware of all measures, facts, and the reality on the ground during this crisis. His Highness the Emir also said that this idea succeeded due to the cooperation and mutual support between the 2 branches, which reached this satisfying result, hoping that this cooperation would continue until the end of this crisis. His Highness also thanked all the ministers for their great job and efforts during this time. His Highness the Emir also thanked the Minister of Health for his exerted efforts and all his orders which come in the interest of citizens' health and security, adding that they did not receive one negative comment during his work, which is a testament of acceptance by the Kuwaiti people to his work during the crisis. The United States is cutting aid to Afghanistan by $1 billion and will cut even more unless the country's feuding political leaders can resolve their differences and form a government that can implement a peace plan with the Taliban. U.S. Secretary of State Mike Pompeo announced the decision after he briefly visited Kabul to try ending the dispute between Afghan President Ashraf Ghani and former Afghan Chief Executive Abdullah Abdullah, who are clashing over the results of their country's presidential election last fall. In a statement, Pompeo said Ghani and Abdullah had informed him that they were unable to agree on an inclusive government despite what the chief U.S. diplomat described as an urgent need to have one. The World Health Organization, or the WHO, has warned that the COVID-19 pandemic is accelerating, with more than 300,000 cases now confirmed at the time of this recording. It took 67 days from the first reported case of COVID-19 to reach 100,000 cases, 11 days for the second 100,000, and just 4 days for the third. However, WHO Director General Tedros Ghebreyesus said it was still possible to change the trajectory. Ghebreyesus urged countries to adopt rigorous testing and contact tracing strategies. He added that he would be asking leaders around the world to take on the virus more aggressively and boost production of protective equipment for healthcare workers. Minister of Public Works and Minister of State for Housing Affairs, Dr. Rana El Faris, gave orders to senior officials in the Ministry and Public Authority for Roads and Land Transport to speed up the completion of road maintenance in the country. Minister El Faris stated that it was time to seize the opportunity of the partial curfew in all parts of the country to lay the asphalt in the damaged roads and carry out the maintenance for the highways. UN Secretary General Antonio Guterres urged and appealed warring parties across the world to lay down their weapons in support of the bigger battle against COVID-19, the common enemy that is now threatening all of humankind. The ceasefire would allow humanitarians to reach populations that are most vulnerable to the spread of COVID-19, which first emerged in Wuhan, China last December and has now been reported in more than 180 countries. The UN chief said his special envoys will work with warring parties to make sure the ceasefire appeal leads to action. Mr. Guterres responded that he is strongly determined, underlining that the UN must be active at this moment and must fully assume its responsibilities. Prime Minister Boris Johnson announced that the UK is banning people from leaving their homes apart from a few very limited reasons, as he imposed the most stringent restrictions seen in Britain since the end of World War II. Johnson's statement that police will break up public gatherings and fine people disobeying the rules, dramatically ramping up the country's response to the growing COVID-19 pandemic. The rules come with deaths from the virus accelerating in the country. A further 54 deaths were announced in the past 24 hours, bringing the nation's total to 335 as of the time of this recording. Government agencies are continuing preventative measures and precautionary steps to limit the spread of COVID-19, as blood transfusion departments have adopted policies to counter the spread in order to protect donors. The blood bank in Jabriya witnessed numerous and intensive campaigns calling for donation, specifically in the crisis of COVID-19. Hadil Fahed has more.
The blood bank has prepared a new mechanism to work against the coronavirus in order to maintain strategic stock in the central bank and ensure blood donation.
We are working in staff nurse in Jabriya blood bank. We are filtering and checking every person who are coming here, and we are checking our temperature for everyone. If the temperature is high, we will send back them to contact to nearest clinic nearby your home, and we are doing our job.
Donors praise the regulation and the precautionary mechanism used to measure the temperature at entry and the providence of sterilization devices.
I'm planning to donate blood because, many people, they are in need of blood, and my blood group is O negative. So O negative is a rare type of blood group, so that's why I'm planning to donate. It's good campaigns encourage people to donate blood, and this is a good time to donate blood, so it's a good thing.
There is too much people who came for the blood. These days, what's happening in Kuwait and all the world. Our team, it's on the health works only. We go to the hospitals of the cancers or the breast cancer. We have many events about the cancer in Kuwait.
Several campaigns run by various associations and volunteers to obtain the largest number of donors.
That's it for tonight. Join us again next week for more weekly news highlights.